But you clearly came home and ate cake for dinner.
Did. Had a couple of bites for cake. My voice is bad.
A couple bites for cake. Mm-hmm. Clearly that has sat with you well.
Health, 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 and health.
Yeah, we talk about pillars of health, and my wife eats cake as one of her four
I am
food
a pillar
groups.
of health. I am a pillar of health that enjoys a little cake. A lot of cake.
Thank you. All right, ready?
Balls deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team. Welcome to another episode of Balls Deep. Kat, how you doing today?
I'm good.
Yeah?
I'm okay.
We're doing back-to-back episodes.
We are. I'm a little tired, but I'm amazing as usual.
Yeah.
And my toe is really improved. I have on an actual shoe
You
today.
do. You do. Yeah. I mean,
A whole shoe.
It's you did awesome. I'm really proud of you.
I did. I was very impressive as a patient. Very tough, very little whining. Pretty much a beast.
Yeah.
Yeah.
I mean,
you would not have done as well.
No.
You would have been pitiful.
No, I'm a man, and we just don't do pain.
You don't. No,
We don't at all. But
Sad.
that ties into our episode today.
Oh, okay, great. What are we talking about?
Well, I don't know if you know this, but there's actually a National Vasectomy Day in November.
Is that a thing?
It really is.
What person came up with a day that is National Vasectomy Day?
Well, it's probably
Who is this?
Well, it's probably a woman who was tired of popping out kids.
Okay, well that is very possible and fair. She was like, "Guess what we're going to do in November? National Vasectomy Day."
All right, we got breast
Line
cancer awareness month.
Right.
This dude's got to get snipped. I got to get off this birth control.
Fair enough. Fair enough.
Yeah.
So, in honor of this, I guess are we talking about vasectomies? I
Yeah,
guess.
I think, what would be, speaking of pain and fear and going through this in an honor and bringing awareness to vasectomies, I thought it'd be helpful for the audience. Let's kind of walk through what to expect before, during, and after the vasectomy. What is the vasectomy experience?
Okay.
Because most guys who come to see us at our practice at Pizzona MD go, that was really easy.
Except for that one guy.
Yes.
There was one guy who literally was not making it. I mean, it was like we had shot him or something.
Yeah, he certainly did the
And I think
hands on
he
the walls.
was working some acting skills, and the woman behind him was rolling her eyes, just forget him, leave him.
Yeah, she was
no
not-
one cares.
she was-
She was not impressed.
Not buying it.
But other than that guy,
Yeah.
everyone else seems to
Everyone
handle
does
this pretty
everyone
well.
does pretty well. Well, ready to jump right in and go deep?
Let's do it.
All right.
Balls deep.
So, the vasectomy experience. Why don't you take us through what happens, how this is going to go, what you're going to feel? Tell us what happens.
You didn't look at any of the notes that we just worked on, did you?
I did not.
You really don't pay attention.
You wanted to talk about... Well, I'm here. Is this not enough? I am here. I have put makeup
Dear
on
Lord.
and washed my hair.
I mean, the coaching that I do, and
Please,
it's just
please. No one cares.
So I think what we talked about beforehand, for those of us who paid attention, let's go pre-visit to start.
Pre-visit.
Yeah. So what to expect before the visit? How does all that go? Is that?
Sure. I'm listening. I'm all ears. I'm all ears. Go for it.
All right. So first and foremost, right, you got to find the right person. Okay. I
assume
think
you're talking about the doctor to perform the vasectomy.
absolutely. So I think,
And it feels like you would want someone very qualified.
let's say this. I've never met a guy who's like, God, I went to this doc. He was the ball doctor. 3 stars. I loved him. Said no man in history.
Said no one ever.
Right? So
Okay.
now listen, obviously we're very proud that our practice is over 1,000 5-star reviews, and those are legitimate, and we take pride in that. And it's an example of the service we give. But nonetheless, a lot of that's driven by the vasectomy experience that we give people. And it's a good indicator of people who, if all these people have a good experience with that person, you got to hedge your bet and think you're probably going to have a good experience also.
I'm going to also go out on a limb and assume you probably want to visit a doctor who does a lot of these things on a consistent basis, right?
Surgical volume, no doubt,
Okay.
equals in a lot of cases better outcomes
Okay.
and a better experience. Now, that being said, I mean, any
Gonna give a
doctor who's
caveat.
listening to this, as surgeons, we operate with people who did it for 30 years and have done thousands, and you're like, well, I don't see that you kind of learned how to do this any better. And thank God you have residents that work with you who are good surgeons to kind of help save you. So experience doesn't always equal it. But I think in the private practice world, if you're not good at what you do,
Word will get out.
100%.
Okay.
Whereas in, I think, some academic centers, we all, for those of us who've been through training, know of some of those people who are like, ooh, you would not do well in the real world, as we say.
Okay.
Not to say academic medicine's not the real world.
Don't dig
but
yourself a hole.
but it's a different sort of animal for the healthcare experience.
So choosing a physician
Absolutely.
to perform your vasectomy.
Yeah, you want volume, you want to look at the ratings, you want to look at their technique. So, we're going to talk about what it's going to be like the day of. Well, does that person offer a minimally invasive option? No needle, no scalpel. In surgery, there's a tenet that, the less you disturb the normal anatomy, the better patients do. Big incisions and moving stuff around and changing the way the good Lord built us in any part of our body is usually not a good thing. It
Not
usually
the best
leads
idea.
to higher rates of infection, higher rates of bleeding. Listen, some people need a big incision because they've got a big, bad problem, but we're talking about pretty small tubes here. I can often do this procedure through a little, couple millimeter little skin poke after numbing you up with a needleless injector. And so you want to find a guy who does it in a minimally invasive way. You want to find someone who offers some sort of supplemental anesthesia like the laughing gas. And then another thing that I think is important, and a lot of patients come to see us for, is not using clips inside to block the tube, because when you leave a little metal clip down in your balls they're there forever.
Oh,
and
leave the. I don't know anything about this clip thing you're talking
Yeah.
about. So in that procedure, they leave a metal something inside.
Usually several. Now they're small,
Several.
but I've had people come up to me in cocktail parties and go, "Hey, can I ask you a question? Had this vasectomy with this guy years ago. Everything went fine, but I keep feeling these clips and they bother me."
Ew.
I'm like, ugh.
Can you take them out later?
I've never gone and done it, but I can say it's would be a very tedious surgery and certainly involve going to the operating room. So,
Okay, yikes.
there are ways to cut the tube and keep it from reconnecting without having to rely on expensive metal clips that are going to sit in someone's body.
So is this a something to avoid? Like if you talk with
I
a
would.
physician and they say, this is how I do this procedure, I use all these clips, and you say, interesting, no thank you.
I would personally, and
Okay.
here's the problem.
Because there are better ways to do it.
Well, again, we're talking about, the best I can do when I do a vasectomy on a patient, I say is the best I can do is break even, right? You're not coming to me ill. I'm not fixing an illness. You're relatively healthy. You're awake during this. You're already afraid. Like my margin for error is minuscule, right?
Okay.
So if I do something that causes you lifelong pain, or it doesn't work, or is an added expense, or is uncomfortable and gives you this terrible experience, you may be less inclined to go to the doctor later in life and get real health care that you need.
That's
so,
true.
so the problem is, and I have patients come and find me all the time because in their research, they go, "You're the only doctor who showed me how you do the procedure." I mean, this on our
Because
website.
there's a video of you doing the
Yeah.
procedure on YouTube,
Absolutely.
which I have seen several times.
And listen, I don't
And
make
it doesn't look very scary.
No, and listen, I don't make any claims, but I'm going to throw out there and have nothing to hide of how I do this. And so there are some guys who, are savvy, and I think we're becoming more savvy healthcare consumers. I think that's awesome. You should know how your doctor's going to do certain things. And again, we're not talking about some major cancer surgery where you got to question how the doctor is going to take out your, a breast lump or a kidney tumor. But when it comes to a vasectomy, there's a lot of information on there. And a lot of the different techniques are going to impact not only your experience, but your recovery. So first thing pre-visit is do your research. Then, there's very little preparation that needs to get done for this. Guys are really worried about, oh my God, what do I have to like?
There's no fasting involved. There's no exercise regime. There's you just show up.
Here's the most,
right?
There's only a couple things you've got to do. Make sure you stop any potential blood thinners. Now, certainly if you're a guy who's got a legitimate medical issue, you've had a blood clot in your legs and you take a serious blood thinner, you've already had a heart attack and you're on some blood thinners because you have a coronary stent, you're going to have to go get clearance by the doctor who's prescribing those medicines. Bleeding is really the only risk in a vasectomy. It's exceedingly rare in my hands and most guys who do a lot of these. So, but we don't want to increase that possibility. So we got to get you off the blood thinner. Short of that, here's the only thing guys got to do. They got to shave their balls. And
okay, then. Well, there's that.
And it's interesting. For some guys, that is hands down the worst part of the whole vasectomy experience.
Okay.
Like seriously, like some guys, again, I'm not going to out myself, but some guys are a little bit more experienced with shaving balls than others. Partly because of my profession. But other guys have really never groomed down there. And ladies know, to get a nice clean shave, you got to have kind of like a smooth line. Well, you look at any ball sack and it's this wrinkly tobacco pouch that, it's hard to kind of make taut and stretch. And depending upon whether you got kind of.
Have you ever had a guy come in that has just cut the crap out of the area?
Absolutely.
I'll just call it the area. Okay, that's terrible.
Yeah, you feel bad. Like I'm laughing.
Do you not do this in the office for the patient?
Yeah, so good question.
I thought that's what y'all did.
We don't. So if a guy doesn't shave his balls, I still do the vasectomy. I know I was part of practices in the past where we had some male nurse get out the old stiff razor and put some soap and listen, I'm about the vasectomy experience for guys. Kind of not the greatest experience to have to go through to do that. And listen, I've had one infection in the last 3,000 vasectomies that I've done. Shaving the hair is not necessary if you've done a lot of these and know how to work around it. Now, one interesting thing that's kind of come up. So there's actually here in Nashville, I think it's a great company. They're called Menscape. And I found them because they actually had a bunch of guys who were having a vasectomy with me. And they decided they were going to go get groomed and waxed down there for their vasectomy.
Okay, stop. Hold, please. Did these guys wax their balls?
They did.
Oh, wish somebody took a video of that, or at least an audio recording of the screams.
No, listen, I
would have enjoyed that. And I know a lot of women could have really, for all the pain we go through, it would be some payback. So they did this.
They did it. And
Menscape.
And again,
Nashville.
I've only spoken to the owner, Agam. He's a great guy. Plug to you if you're in Nashville and want to get some.
Your balls waxed.
Well, they do other men's grooming. They do skin care. They do hair removal elsewhere. And they do a great job giving guys an awesome experience. But according to him and his therapist, who he works with, guys do remarkably well. Now, maybe this is a future.
I'm going to be making a visit over to Menscape this week. I would like to have some research on that.
I don't want to say this because I may be obligating myself to it, but talk about a funny video and podcast.
Oh, are you volunteering?
I don't know if I'm ready for that, but we'll
my God. Stay tuned, everyone.
We'll table that.
All right. Well, we'll table that conversation, but.
That shit better go viral if I'm going to do that.
Wow. All right. You come into the office. You have arrived. The balls are waxed.
Excuse me.
You're ready to go for your vasectomy. Now what happens?
Well, I'm got to regather myself after the choking after thought of me in my stupor from being awake all day, offering to wax my nuts and record it.
He's clearly delirious.
It would just be the audio, just to be clear.
He's delirious.
So. That's all the prep that's doing. So, right, now you're in my office. So what's the day of experience? So first and foremost, we offer same-day consultations and procedures. I don't understand why doctors make healthcare so complex and difficult. There is zero reason that a grown-ass man who has decided he does not want to have any kids moving forward can't come in the same day, hear a vasectomy consult, and get snipped the same day.
Sure.
Why most other practices not only can't get guys in for a vasectomy consult for months, but then once they get in, they have to wait further months to get in is mind-boggling. But thank you. We now have a business opportunity. So we just get you in that week, same day visit, same day consult.
Okay, that's great.
So that's first and foremost. You don't need to take 8 days off of work to go
Well,
have a
and
vasectomy.
you have to make 2 trips. That's annoying.
It's absurd.
We want to go in, talk about the Botox, get the Botox immediately.
Always back to beauty. Can we just focus on guys and our nuts right now? This is a very stressful experience.
Sorry, go ahead.
And I think this is why, we had one guy drive 6 hours to come see us. And he said,
That's right.
I researched, he said, the poor guy was such an anxious mess. And he knew it. He just worked up in his mind. Like he knew that if he had to have a delay between the consult and the procedure, he'd never do it.
He'd chicken out. Okay.
He'd just never do it. And he wasn't even, he did great with the procedure. It wasn't even like, I'm freaked out over pain. It was just the anxiety and the overthinking of it, right? So he drove 6 hours to come have his vasectomy because that was easier than having to take 2 days off. So come in the same day. We have all the information on our website. So again, what do you do pre-visit? Do all your homework.
You research, you read, you look at all the questions, read the answers, do your end of the research.
I make it even easier. We make videos and we don't like reading. We're
You
men.
can just watch stuff.
Just watch some stuff, right? All questions answered. So I meet a guy, hey, how you doing? Are you on any blood thinners? Have you ever had surgeries? Drop your drawers. Okay, I could feel your balls, feel your tubes. Everything's healthy. And then we just chit chat and we're ready to go. Number 2, we're going to get guys high during the procedure. We talked about the laughing gas that we offer.
Yeah, I think you need to explain that a little bit. We're not offering 8 balls of cocaine. You're offering a medical grade. What kind of gas is this?
Nitrous oxide.
Nitrous oxide. It's like the old dentist gas.
Laughing gas. Exactly.
Laughing gas.
Yep.
Okay, so you breathe
So
this
we're going to
in.
legally get you, quote, high, not on weed gummies or your 8 ball of coke.
Yes,
Jesus.
very well. I'm just making.
I don't want to know what you did in your 20s.
No, but I am making a distinction that this is
correct.
a medical high.
Yes, absolutely.
Relaxes you.
It's safe. You can drive afterwards. You control the experience.
Okay.
It wears off within a couple minutes. There's no lingering sort of days from it at all. And guys do really well with it. Probably about 90% of guys do it. And what I tell guys is this. I have no idea of knowing what you are going to feel. But what I can tell you is 90% of our patients choose the laughing gas, and almost every guy is happy that he did. And that of the guys who have maybe I don't want to say the worst experience, because really no one has a bad experience in our office, to be perfectly honest. The guys who maybe don't do quite as well are guys who chose not to do the laughing gas because they were cheap. They just didn't want to pay $100 to do the medicine. And those are the guys who struggle. Now, mindset matters. So I would also say pre-visit, get in a positive headspace. Like, it's so amazing. The guy who comes in a nervous wreck often has more discomfort than the guy who just comes in and goes, Doc, I trust you. I know it might be uncomfortable, but let's just do it. And it's amazing how often that sort of happens. And that's probably the biggest predictor of pain. Mm-hmm. What is your mindset going in? So guys, you're in control of the pain so much more so than I am, because I do that the same way on all 3,000 guys I've taken care of the past 4 years and thousands of guys before that. So why do some guys do better or worse? Well, we all have different nerve endings, but this is probably our biggest determinant of our experience.
So you're in there.
Yeah.
You're on the gas.
Yep.
Tell us about the little, and I call everything little, but the little vasectomy procedure, because it's really not. I've seen this on the YouTube video. It's really not a huge deal.
Yeah.
Right?
Now, let me just back up.
It is a big deal, but it's not some crazy surgery.
Correct. Now, let me just briefly back up one part that I missed. That again, we want to give guys an idea of what's the experience. So before we get you high, and after I'm done chatting with you, I'm going to step out of the room. Guys are going to get undressed from the waist down, sit on a table, put a gown over them. And then our nurse is going to come in and clean you off with some soap and water, put a nice warm towel on you to relax the boys. We know that cold balls pull up, warm balls relax. We want to relax everything down there, give you a little spa-like treatment.
Wow.
And, we also put on some music. And it's amazing how big of a difference that makes. Like, guys, the other day
This is the reason that my workout music cuts out on Fridays.
Oh, yeah, we're stealing the Pandora account, 100%.
You're stealing the music for the vasectomy patients.
Well, dude,
good to know.
Just put on your Lizzo on repeat. You'll be fine.
I like Lizzo.
But no, in all seriousness, like just the other day, I was like, oh, my buddy was in just like an hour and a half ago. He said, your playlist was awesome. This is great. And kind of funny how often a classic rock song comes on and you're like, comfortably numb. Should I stay or should I go?
Love it.
The one the other day
Love
was,
it.
Is This Love by Whitesnake? And so I'm doing the procedure and I looked at the guy and I was like, hey, Wes, is this love? Is this love that I'm feeling?
Oh my gosh.
But in all seriousness, we think about these things because they matter for the experience. And we do laugh, and I'm there talking to the guys. So, we think of these things. And then, yes, we get the guy. He controls his level of highness on the laughing gas. And then the procedure. I numb you up without a needle. It injects local anesthesia into the skin. It's a single, less than a 5 millimeter little skin poke I make with an instrument without slicing you open with a scalpel. We're going to cut, cauterize, and suture the tube, the two ends of the tube once we cut them away from themselves. You have a tube on the left and a tube on the right, assuming you got two balls, and we can do them both through that same incision, usually done in less than 10 minutes. No clips. There's no permanent stitches involved. The skin poke is so small, we even just while you're numbed, put a little clamp on to kind of crimp it back together for a couple minutes. I step out, nurse comes in, takes it off. The laughing gas is worn off. We give you an ice pack. We give you a goodie bag. You get dressed and you're driving yourself home.
And you go home. And that's it.
And that's it. So really, I love our vasectomy Fridays. I really I love what I'm doing with building our practice. I love talking to you and doing this podcast. But boy, those vasectomy Fridays, they are fun. They're really, because I get to just talk to cool, normal guys and meet people from all walks of life. And it's neat to see a guy who comes in so, scared or worried and just unsure of what it's going to be like. And they're like, dude, this was easy. Like, you're a cool guy. Like, and interestingly, like, a lot of I've made friends this way. It's a weird way to make friends and for you to make friends.
But it's accurate and funny. I have friends. Yes. We shouldn't share that, but.
Well, no, we're not giving away names or something, but
my friends are people that you gave their husbands a vasectomy. This is actually true. This is how I have made friends.
Yeah. But the point being, it's like, I'm a guy. I'm operating on someone or doing a minor procedure on just some dude who's like me. And so I try and think about that and give these guys a good experience. So,
well, I think that kind of takes care of like the whole experience talk.
Well, yeah. Let's talk real briefly about afterwards. Because again,
after. Well, you said you gave an ice pack. No, I didn't read it at all.
You didn't read any of the notes.
No, I didn't. But you said you gave them an ice pack and you sent them home to recover. And
Chad, can you get some cue cards to like hold up for her so she can kind of look at?
I don't need a cue card.
Dear Lord, you went to acting school?
Yeah, that's why I don't need any notes. That's great.
I just don't think you pay attention to this.
I don't. So what do you want to say about after the vasectomy?
Well, it's important, right? Guys want to know what the experience is like afterwards, right?
How long does it take to kind of recover from this? How many days are you down?
So I tell guys, give it a week for sex, a week for exercise or pushing any sort of significant weight. Now, walking, driving, going up and down stairs.
You're fine.
Day-to-day office work, day-to-day dad work, you're cool, right? Now, if you want to milk it and not have to go to another softball or basketball game by all means milk it and say, I told you to sit in the couch. But for the most part, you can kind of do that sort of day-to-day stuff. Now, I've done this on some very good friends, and they're often texting me, dude, do you even do anything? Like, that was pretty easy. Like I barely feel anything. And then I've had other guys who 3-4 weeks out are coming back to see me in the office and like, all right, Dr. P, I'm really worried. My ball's still achy. I feel a bump. Like, I think something bad's going on. Like, I did this research and I went on Dr. Google, and the guy's fine. He's got a little bit of swelling where I cut the tube. As you'd imagine, you cut something, it's going to swell up a little bit. Everyone has different pain tolerance. And some guys do have some swelling or inflammation that, can be a little uncomfortable and sometimes very uncomfortable because it presses on the nerve endings. And in all seriousness, testicles are very sensitive. I mean, they're similar to ovaries. They're kind of internal organs that hang outside the body. So it can be uncomfortable. But the norm typically is it's not as bad as I thought it was going to be. The majority of guys a week out are good. The chance of a chronic testicle pain is well under 1%. We're talking about a pain that starts the day of the vasectomy, doesn't get better, and we're now 6 months out and you're still having it. Those are rare situations. I've probably had, again, one guy in the past 4 years, 3,000 plus vasectomies, who legitimately had this. It's called post-vasectomy pain syndrome. And he had to go and see a specialized microsurgeon to solve the issue by actually reversing the vasectomy and kind of relieving that back pressure. So you'd think it happened more often if truly pressure caused it. But it's, again, one guy out of 3,000, pretty darn rare. So for the most part, again, the recovery is really not that bad. So for guys to, again, think about this scary experience beforehand, what it's going to be like the day of and then after, most guys go through this and they go, dude, that was easy. Go see Pozzona. And that's why we see a lot of patients send over their buddies, send over their colleagues. And if you're not in the Nashville area, there's plenty of other Pozzonas out there who do a fantastic job. But, again, do your research, do your homework, find guys who do this technique. And if they do a lot of them, they probably give a good experience.
Okay, I'm scared to ask. Is there anything else you would like to say about the vasectomy experience?
No, I think I did it. I think I probably just did just the tips segment, but do you want to at least give that a try?
I mean, I'll give it a shot.
Just the tip.
Okay, so number one, Smarty Pants over here wants you to do some very significant research to find a highly rated urologist who has done a lot of vasectomies to perform your vasectomy. Number two, on the day of the procedure, relax. It's really not going to be that big a deal. It's not as scary as you think it's going to be. It's not like some of the things women do. This is easy. Number three, take it easy for a week, maybe a full week if you weren't trying to get out of a few things. And 99% of men have no long-term issues from a vasectomy.
That was fantastic.
Honestly, it was.
You see what happens when you focus a little bit, read your notes? I mean, that was awesome.
I think I'm awesome anyway.
You are. This is fun.
Well, thanks for having me.
Absolutely. Well, until next time. So
okay, wrap it up.
Stream team, thanks as always. Hope you had fun. Please follow us on YouTube. I think the video portion of this is probably fun because, again, I'm Italian. I have hand gestures and various other things.
I wore a cute sweater.
Well, yeah, right. And we want to see what Kat wears and check on her toe and
shoe.
Her facial expressions are usually priceless, and sometimes I'm occasionally charming. So
occasionally.
So, but other than that, please show yourself some more grace and kindness and love and all that good stuff. We're all works in progress. None of us are perfect, but these are opportunities to grow. Hope you guys have a beautiful rest of your day and a happy vasectomy day. Call your local urologist and go get snipped. Have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pozzona MD, please visit pozzonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.